Welcome back. We are going to continue our conversation about being proactive in managing memory loss. And in this section, we're talking about the different types of dementia so that you can learn more about how to plan, care, and interact with your elderly parents. As always, I want to get started with a few housekeeping tips. Let me advance the slides and we will quickly talk about those. So, you know the real. I use the term elderly parent or elderly parents. You want to substitute that term with whoever you take care of. The outline for this module is in the course materials for the program. Please do print the slide handouts, make notes, write questions, and the ellipses are purposely on those slides so that you can participate along with me. Let's talk about the objectives of the types of dementia. At the end of this section, the types of dementia, you should be able to describe the difference between Alzheimer's and vascular dementia and distinguish characteristics of other types of dementia. You should develop an awareness of the complexities of care needs and be able to predict how family relationships with your parents or with a spouse will change over time. Let's answer the question. What is dementia? Dementia is an umbrella term. So if you imagine an umbrella, you've got rain coming down and it's hitting the umbrella, and then under the umbrella you have all these other things. Dementia is an umbrella term that describes memory loss. Underneath that umbrella is Alzheimer's disease. And while Alzheimer's disease is the most common, individuals are often diagnosed with multiple types of dementia. And we'll talk about the types and the descriptions so that you can familiarize yourself with the different types of dementia. Thorough screening is important. Insights into the differences can help you give better care and can help you understand more about what's going on. Thorough screening through the test papers that we talked about, the scans, the blood tests, evaluations by a neuropsychologist and a neurologist, those provide the most comprehensive analysis to confirm the type of dementia. Insights into the differences between the types of dementia help you be more empathetic and compassionate to understand what your elderly parent is going through. Think of this. How would you feel if you realized you were losing your mental ability to function? How would you feel if you knew that your actions and the fact that you could not remember things were driving your family members crazy? While it's impossible for any of us to understand the experience of an elderly parent with dementia, recognizing the differences between the types of dementia can influence the way that we care and love elderly parents with dementia. Alzheimer's disease. According to the Alzheimer's Association, it's the most common type of dementia, represents 60 to 80% of those diagnosed with memory loss, 60 to 80%. Difficulties, we've talked about these, short-term memory loss, difficulty remembering names, events, word finding, poor judgment, and inability to make decisions. Money becomes more difficult to manage. Hygiene, bathing, changing clothes, brushing teeth, those tasks go uncompleted. Weight loss can occur because of forgetting to eat. Early mobility concerns, walking, balance, and gait can turn into more serious things like falls. The important thing to realize is that as time progresses, caregivers will do more. As you begin to talk to elderly parents about the type of assistance needed and develop a practical plan, it's important to know that as time progresses, you will do more. You will do more things like more hands-on assistance and reminding for all activities of daily living. Things like helping with bathing, dressing, eating, toileting, transferring. Simple directions about how to stand up from a chair or how to sit down will eventually become necessary. That activity is called prompting. Confusion between day and night will happen. Behaviors may occur as well as depression. Physical abilities eventually decline. Speaking and eating become more difficult. Swallowing food can result in choking that then results in pneumonia. Toward the end of life, individuals with Alzheimer's will sleep most of the day. food intake, body functions decline, which is where I want to talk about palliative and hospice care at the end of life. Palliative care and hospice care at the end of life. It offers additional support in the home or wherever the person is. Caregivers receive support from palliative and hospice care providers to help understand how the disease progresses to end of life. Grief counseling is offered. It can be of significant benefit, especially to full-time caregivers who are losing a significant part of their daily life. They're losing the person that they devote all of their time to. It's a sad subject. It can make you sad thinking about it. But as with learning about all aspects of Alzheimer's disease, I encourage you to learn more about all of the available services, how they can help you, and the benefits. Palliative care and hospice care is reimbursed by Medicare. It can be a great support for caregivers during the last 6 months of life. It does require individuals to qualify. Let's talk about vascular dementia. We talked earlier in this program about how vascular dementia arises from cardiovascular issues. So if you remember, high blood pressure, high cholesterol, clogs in the arteries result in vascular dementia. According to the Alzheimer's Association, 50% of individuals with Alzheimer's disease also have a diagnosis of vascular dementia. So it's a high percentage that have both. Vascular dementia results from all the chronic diseases that we talked about: heart disease, diabetes, stroke, mini strokes called TIAs that can barely be noticeable. My mother would have eventually had vascular dementia had she not passed away from conditions related to heart disease and smoking. In this slide, and then in subsequent slides, we'll review the different types of dementia to increase awareness that dementia is just not this catch-all. It's not just dementia. It's more than that. Individuals with vascular dementia, they can present with difficulties related to decision-making, planning, organizing, in comparison with the forgetfulness that's associated with Alzheimer's disease. If you remember, we talked about one of my clients who had difficulty doing the church newsletter. She had Alzheimer's and partially vascular dementia. The main cause of vascular dementia is strokes. As a result of a stroke, we've got difficulties with physical abilities that happen, a slow gait, poor balance, memory loss, combination of things. Let's talk about dementia with Lewy bodies. Dementia with Lewy bodies and Parkinson's disease have similarities. According to the Alzheimer's Association, DLB, that is dementia with Lewy bodies, begins with cognitive impairment. Parkinson's, on the other hand, begins with physical weakness and impairment and tremors. Individuals with DLB often also have Alzheimer's disease. They may also have vascular dementia. It's called mixed dementia. The interesting thing, though, is individuals with DLB will often have visual hallucinations, meaning that they see something that is or is not there. They can have sleep disturbances as well as physical concerns, slow walking, poor gait, stiff movements. One of my clients years ago had dementia with Lewy bodies, and separately, I had a client who had Parkinson's disease. The woman who had DLB had visual hallucinations. She would get very panicky because she would see bugs crawling on the wall. She would imagine people underneath her bed in her bedroom. And she couldn't distinguish between, is this real? Is this not real? She was very scared much of the time. And these were behaviors that her family had to get used to, had to be able to reassure her to say, oh, you know what? Let me get that bug off the wall. Let me go get that person out from under your bed. I'll get rid of them for you. So you don't tell the people that their hallucinations are not real. You don't tell them that they are not valid if they do not recognize them as such. Now, my male client with Parkinson's disease, he knew they weren't real. He would say to me, Pamela, I see a person over there. They're really not there, are they? And I would say, John, I don't see anybody. So for me, they're not real. For you, they may be real. So he knew the difference, and he knew enough to ask and say, I'm seeing this over here. Can you tell me if what I'm seeing is there or not? Learning the different types of dementia and learning these small nuances help us reassure our family members and help us learn how to react positively so we're not denying their experiences. That is so, so important. Let's talk a little bit about Parkinson's disease. Parkinson's disease is a movement disorder that extends to symptoms of dementia with the passing of time. The initial concerns are with movement. Parkinson's disease can be noted by a slow walking speed, a rigid body, so like a body that's tight and not easily flexible, tremors, so hands shaking, arms shaking, and shuffling of the feet. So the feet are not picked up, they're just shuffled. You may notice that individuals with Parkinson's disease speak with a soft voice that can be very difficult to hear. They lose the expression on their face where it appears that they're just almost like frozen. The emotions are unable to be expressed because their facial muscles don't work anymore. That condition is called a flat affect, Eating becomes more difficult. A couple reasons. Because of tremors in the hands, so holding and picking up utensils and picking up food can be more difficult. You may be able to scoop up something on a fork, but you can't get that to your mouth without shaking and having it fall on the plate. Many individuals with Parkinson's disease need assistance, and they're fed. Swallowing and choking are also concerns for persons diagnosed with Parkinson's disease, as they are for all people with dementia, because if they choke, food can be aspirated into the lungs and pneumonia can result. Because of the significant changes resulting from Parkinson's disease, depression, fatigue can be very common. They can walk maybe to the kitchen and then all of a sudden they are exhausted. Over time, that physical weakness eventually results in a need for total physical care, including feeding and support with transfers, very similar to people diagnosed with dementia. And again, as we talked, people with Parkinson's disease can experience hallucinations, but some of them know that they are hallucinating. Before we go too far, I want to talk about appreciation. And I want to share a client story. This was a personal story of mine, and I call it Two Couples on a Flight from Cancun. A few years ago, I was on vacation, my husband and I, and we were in Mexico, and we were coming back through the Cancun airport. It was busy. I think it was spring break. It was just crazy. And if you've ever traveled during spring break, you know what that's like. So I was mourning the fact that vacation was over so quickly and I was having to go back to work. And so we got on the plane, and while we were getting seated, I was overhearing the conversation of two couples in a row in front of us. One of the couple, the husband was saying, "Oh, can I change seats with your husband or your wife? You know, somehow the seats got mixed up. I want to be able to sit next to my wife. Would you mind?" And the lady said, "Well, normally I wouldn't mind under any circumstances, but unfortunately I'm here next to my husband, and my husband has Lou Gehrig's disease." We'll talk about Lou Gehrig's disease in a minute, but if you know anything about it, it is a disease that can come on at a very young age, and it paralyzes all of the muscles in the body, and eventually you can't move, and people die from it. And so the husband and the other couple said, "Oh my gosh, I so understand what you're going through. My wife has PPA and PSA." So what his wife had was two things going on. She was losing her ability to communicate verbally. So words wouldn't come out like normal. And then she also had the aspect of having physical difficulty. So he actually had to lift her and pick her up to move her. Now I'm hearing all this, and a few minutes before this, I was feeling very sorry for myself and having a pity party about having to go back to work after vacation. And I thought, oh my God just thumped me on the head and said, "Pamela, look at your life. You just were on vacation. You are so fortunate. You don't have any health issues, nothing major. You work, you have a good life. Here are two couples in front of you, probably going on the last vacation they will ever go on with that spouse because of the health issues of that spouse. And I thought, oh my gosh, I have so much to appreciate. And these people are expressing appreciation and expressing concern for each other because of what they're going through. It takes a caregiver to know what another caregiver goes through, especially in those extreme situations. I talk about the importance of caregiver support all the time, whether it is online, groups like this, webinars, education. I cannot stress it enough. It is so important. And with yourself and your elderly parent, find 3 things to appreciate every day. It helps us get through life a little bit easier, and it helps us to appreciate the things that we still can appreciate and the things that we still have. Let me advance the slide, take myself off camera, and we will continue. So let's talk about mixed dementias. These are the dementias that I talk about that have aspects to them that if you learn about them, you can provide better and more specialized care to your elderly parent. So the first is FTLD. It's called frontotemporal lobar dementia. And it also includes behavioral variant dementia. The others listed on here are Pick's disease, cordocobasal degeneration, PSP, PPA, and Lou Gehrig's disease that we'll talk about. So let's talk about the frontotemporal dementia. It's a type of dementia that happens when people are younger, between the ages of 45 and 64. This type of dementia, the frontal temporal lobe of our brain regulates our social activities, our ability to manage our emotions and our anger. So sometimes people with this disease can be very aggressive in physical and in verbal. This is a very difficult type of dementia to manage if you are a caregiver. Make sure that you get extra support. Make sure that you learn more about the disease. Pick's disease also affects the frontal and the temporal lobes. Language is affected, planning, executive function, emotional control, and judgment. Similar to FTLD, there are some mood changes, some inappropriate behavior, some repetitive behaviors. It also is a younger disease diagnosed between the ages of 40 and 60. Cordocobasal degeneration, it's very rare, less than 5% of the population. You're unlikely to run into it, but I want to mention it. Coordinating body movements can become difficult, and it starts on one side of the body and then it goes to another. So an example is, let's say that you have an arm or a leg that's very stiff, it's clumsy, it's uncoordinated. That's how this starts, and then it moves to the other side of the body and it's on both sides. PSP is difficulty with balance, walking, eye movement. Persons with PSP also experience personality changes, like people with dementia. It's often misdiagnosed as Parkinson's disease. The PPA, which is the primary progressive aphasia, as we talked about with my client on the airplane, it's also rare, but the person starts to lose their speech. They may not also be able to understand things that are in writing and understand what people are saying to them. And it's progressive. The ALS is Lou Gehrig's disease. About a third of people with ALS also have frontotemporal dementia. The two diseases are very similar from a genetic perspective. They both affect people at younger ages, and there is no cure for ALS. People with ALS eventually lose all of their strength, their muscle strength, their ability to move arms, legs, and body. Let's talk about a few other types of mixed dementias: Creutzfeldt-Jakob and normal pressure hydrocephalus. Again, Creutzfeldt is a rare disease affecting about 1 person in 1,000,000 per year, but it's also characterized by dementia and a lack of motor coordination. It's rapidly fatal. People pass away very quickly. Normal pressure hydrocephalus is characterized by fluid buildup in the brain. And a lot of people who are diagnosed with this are never talked about the progression to dementia. The initial symptoms are difficulty walking, so gait disturbances, incontinence, problems with bladder control. The treatment usually happens by placing a shunt in the brain to divert the spinal fluid into another part of the body. These people do develop dementia and Alzheimer's disease. It is not talked a lot about. If this is a diagnosis in your family, make sure that you are asking questions. There are other mixed dementias that involve components of memory loss, multiple sclerosis, brain injuries, Down syndrome, as we've talked before. Let's talk about the statement that I hear so much from spouses and children who say, oh my gosh, I feel more like a caregiver. I was a wife at one time, I was a son or daughter at one time, but not anymore. While having a diagnosis helps family members respond with empathy and compassion, the deeply forgetful, and that is a term coined by Stephen Post, take more care over time. Spouses or partners really face a future without an equal partner. Losing that romantic relationship that changes to a caregiver status is very difficult. The closeness of the marital relationship suffer because the intimate conversations can no longer happen because the person with dementia can't respond and cannot follow conversations. Spouses and adult children feel more like a caregiver than a wife, a daughter, or a son. Interactions begin to focus on daily tasks around the house, hands-on care, personal care. Being a caregiver can be very isolating, depression-filled, and lonely. Imagine how you might feel if you couldn't leave the home because of safety concerns for an elderly parent or a spouse with dementia. Your only way to leave that house is to have somebody else come and watch your parent or your spouse. Your friends have stopped calling because they don't know what to say. They know that you can't get out. They don't know how to have conversations with you anymore. All of the social activities that you used to enjoy, not anymore. Your life is totally focused on being a caregiver. Let's talk about the importance of caregiver support. Because of the isolation, the loneliness, the depression that can happen, even if you're not the 24/7 caregiver, it is essential for caregivers to access caregiver support early in the stages of caregiving. Courses at the Alzheimer's Association, webinars like these, books, online support groups. Learning how to care for an elderly parent with memory loss, it takes special skills and it can be emotionally draining. For your elderly parents, if they are the caregiver for your mom or dad, learn to be empathetic about the significance of the change in their relationship with your mom or dad and be as supportive as you can. Again, it's hard to imagine being in that situation until we are, but caregiver support helps with confidence, learning new skills, and there are fewer feelings of isolation that result from interactions with other caregivers, from sharing stories with other caregivers. So important. So the summary for the types of dementia. Dementia and Alzheimer's disease, other related memory loss diagnosis can be frightening for the person diagnosed, can be frightening for the family. The progression of the care is difficult for family members to even imagine what's going to happen next, which is why it's important to be with other caregivers and in groups where you can see where you are today and learn a little about the future. Again, with a lot of these webinars that you're going to participate in, not all the information will be relevant to you today. Some of it will. You'll hear something about the future. Eventually, something will happen and you'll come back and you'll watch the webinar again, and all of this will make more sense to you. Caregivers become more compassionate when you talk about fears with your elderly parents, with your spouses, by gaining a better understanding of the different types of memory loss diagnosis. We all become more compassionate caregivers. We become more compassionate and patient with ourselves on days that we become frustrated and angry and we feel like we want to run away, and days that we feel like we can't do it anymore. I thank you so much for being with me for the types of dementia and for learning about this. On the days when you need extra caregiver support, reach out to someone, make a phone call, email someone in your caregiver support group, post something on a site, seek out information. I have had caregivers who have found me on the internet, on my Facebook page, on social media, who said, you know, the day I found you, I was about ready to commit suicide. I was about ready to end it all because I didn't know what to do. Helpful information is out there. You have to seek it out. You have to ask for help. Waiting and expecting some miracle from above to happen doesn't always work. The more that you are proactive to seek out help, the easier caregiving will be, the easier it will be to manage the emotions and the stress. Never give up. Help, hope, and support are here. They're on my website at PamelaDWilson.com. They're in these webinars. I'll see you in the next webinar.